We're going to see the Shilling test for vitamin B12 deficiency. So the patient comes with signs and symptoms of vitamin B12 deficiency. Signs could be, for example, in the incomplete blood cell count. We will see that the mean corpuscular volume is larger than 100 femtoliters, usually greater than 110 femtoliters. Well, that's one thing. Other is the patient would have symptoms of anemia, and sometimes the combined is spinocerebellar diminution. This would be the tracts that are affected are the lateral corticospinal tract, dorsal columns, and the spinocerebellar tract. The dorsal column would be for temperature, for proprioception and fine touch. So the patient would be a little bit unsure when he's walking, especially at night, and the Romberg test would be positive. Remember that Romberg test is positive. That means there is a problem with proprioception, not a cerebellar disturbance, because if the patient has cerebellar disturbance, he's going to be unsure of the walks, that does, etc. Even though the patient has the eyes open. So proprioception we tested with Romberg test. All right. But also here we will have the spinocerebellar tract damage. Well, anyway. So when we suspect vitamin B12 deficiency, now in order to see the causes of vitamin B12 deficiency, we do Shilling test. Shilling tests have 4 stages. Stage 1, 2, 3, and 4. So in the first stage, we will give intramuscular vitamin B12 and radio-labeled vitamin B12. The intramuscular is in order to replete the tissues with vitamin B12, and we give radioactive vitamin B12 orally, and after that is absorbed, then is not going to be taken by tissues because we already give the intramuscular B12 that is repleting the tissue with vitamin B12, but because the patient absorbed the radio-labeled vitamin B12, now it's going to appear in the urine. So if after we give this, we measure, here we have the urine vitamin B12. If it is high, then we know that the reason for which the patient had the vitamin B12 deficiency was a dietary deficiency, because the patient is not taking vitamin B12. So high, then dietary deficiency. If it continues to be low, that is, we don't have any measure of vitamin B12 in the urine, that is because the patient is not absorbing the radio-labeled vitamin B12, because it's not absorbing it, we don't see it in the urine. So we pass to stage 2. And here in the stage 2, we give the radio-labeled vitamin B12 plus the mucosal intrinsic factor. So if the patient had the pernicious anemia, in which the reason for which is not absorbing the vitamin B12 was because there is the lacking of the intrinsic factor, now that we're giving it, the patient will absorb the radio-labeled vitamin B12 and we will see it in the urine. So now if we see high concentration of vitamin B12 in the urine, then this was pernicious anemia. If we see it low, then we go to stage 3. In the stage 3, we give again radio-labeled vitamin B12 plus antimicrobiotics or antibiotics. If we give these antibiotics, we are decreasing the growth of bacteria that are taking vitamin B12, and so if after giving the antibiotics we see high concentration of vitamin B12 in the urine, this was small intestine bacterial overgrowth. If we see it low, that is, we don't see vitamin B12 in the urine, then we pass to stage 4. And in the stage 4, we finally give again radio-labeled vitamin B12 plus pancreatic enzymes. If it is high, then the patient has vitamin B12 deficiency due to pancreatic insufficiency. And if it is low, then the cause of vitamin B12 deficiency, that is because of the patient not being absorbing the vitamin B12, is due to other causes, other different than this. For example, obstruction of the small intestine. For example, like let's say could be the phyllobotremulatum, for example. So the most important are the stage 1 and stage 2. So remember, first we give intramuscular vitamin B12 in order to replenish the body with vitamin B12, and so that when the patient absorbs vitamin B12, just appear in the urine, because if the body takes it, then it's going to appear in the urine. If it's high, now the concentration of vitamin B12 in the urine, then it was because they dietary deficiency. If it is low, then the patient is unable to absorb it. That doesn't mean that the patient is not taking vitamin B12, and so we go to stage 2, in which we give intrinsic factor, and if now it is high, that is pernicious anemia. If it is low, we continue to stage 3, we give antibiotics. If we see it now in the urine, this was small intestinal bacterial overgrowth. If it is low, stage 4, and here we give pancreatic enzymes. If it is high, it was pancreatic insufficiency, and if not, there is other causes like obstruction. So this is the Shilling test for vitamin B12 deficiency.